Gastroesophageal reflux disease, or GERD, is a digestive disorder that affects the lower esophageal sphincter, or LES, which is basically the ring of the muscles between the esophagus and the stomach. And basically, what occurs is that stomach acid or stomach content, there would be a backflow into the food pipe, or what we call esophagus, due to a weakened esophageal sphincter. Okay? Now, the backflow or the reflux can irritate the lining of the esophagus and causes you to have pain, and that's what GERD is. Okay? So again, there's basically an inappropriate relaxation of the LES muscle, or the lower esophageal sphincter, right? Which is the ring muscle between the esophagus and the stomach, therefore causing the backflow of GI contents up into the esophagus. And the gastric acid and the pepsin can cause tissue injury within our esophagus, and this can result in what we call Barré's epithelium or Barré syndrome. So what is Barré's epithelium or Barré syndrome? It basically refers to the abnormal change, which is what we call metaplasia, within the cells of the lower portion of the esophagus. And this occurs due to the backflow of the gastric acid and the pepsin, and it's usually characterized by the replacement of this what we call normal squamous epithelium lining within the esophagus, and it becomes replaced with simple columnar epithelium with goblet cells, right? And basically these goblet cells are usually what is found in the GI tract. And the problem with this is that this can be a medical issue because there's a strong association with Barré's esophagus or Barré's epithelium with esophageal adenocarcinoma, which is basically esophageal cancer. So basically, this can be considered a pre-malignant condition. Okay, so we need to be aware of this. So how do we assess our patients? We can see that the patient might have heartburn, or what we call dyspepsia, and the pain can be up and down the chest region. There can also be regurgitation, so we gotta monitor for crackles in the lungs because the patient can be a risk for aspiration. Okay, there could also be hypersalivation and dysphagia. Now, dysphagia could be due to the narrowing of the esophagus, so the constricting of the esophagus can cause dysphagia. Okay, now let's look at the treatment for our patient. We can administer antacids because what it does is it neutralizes the acidity in the stomach, and examples could be Mylanta and Maalox. We could also give the patient PPI, or proton pump inhibitors, and this reduces the production of acid again. Main drugs that you might encounter in the NCLEX can include lansoprazole and omeprazole. Okay. Hepatitis can be temporary, or what we call acute, or it can be long-term, which is chronic, depending on whether it lasts for less than or more than 6 months. Okay, now acute hepatitis can sometimes resolve on its own, or it can progress to a chronic hepatitis. But the thing is, if it's not treated, it can eventually lead to acute liver failure. And what happens over time is that chronic form can progress to a scarring of the liver, right? Or can even cause, like I said, liver failure or liver cancer too. Now, let's talk about classifications of hepatitis and the way of transmission. Now, there are actually 5 types of hepatitis. There's A, B, C, D, and E. And this is a quick review, so we're just going to go over basically the first three hepatitis, which is A, B, and C. Now, let's start with hepatitis A. The incubation period usually can last from 15 to 45 days. And it can be transmitted primarily through fecal and oral route. So prevention basically includes sanitation and hand washing, okay? And there is a vaccine available for hepatitis A. Now, with hepatitis B, it's transmitted through blood-to-blood contact, also sexual contact, and drug use. So being in contact with needles and razors. Now, there is also a vaccine that is available for hepatitis B. Okay, now lastly, we will look at the most serious one actually, which is hepatitis C. And hepatitis C is transmitted again through blood-to-blood contact and also sexual contact and drug use. Now, take note that the patient can be asymptomatic with a person with hepatitis C, and some are only diagnosed once abnormality is being detected within the liver enzymes. Now, symptoms of acute hepatitis C includes fever, fatigue, loss of appetite, nausea and vomiting, abdominal pain, and jaundice, okay, which is the yellow discoloration. Now, here are a few of the things that you want to keep in mind for your NCLEX exam. Now, with hepatitis B and hepatitis C, it is connected with cirrhosis and liver cancer, okay? Now, also, what we call enzyme-linked immunosorbent assay, or what we call ELISA test, is the initial screening test for these clients suspected of being infected with hepatitis C, HCV virus. Now, liver biopsy can also be used to confirm the diagnosis of hepatitis, okay? And the treatment most often used for a patient with hepatitis C is a combination of two medicines, interferon and ribavirin, okay? Appendicitis is basically an inflammation in the appendix, which is a couple of inches of tube of tissue that extends from the large intestine. And it usually results from obstruction, inflammation, and definitely an infection. Okay? Now, appendicitis is a medical emergency, which means that it needs surgery to remove the appendix. Okay? And if left untreated, an inflamed appendix will eventually burst, or what we call perforate, and it can spill infectious materials into the abdominal cavity, which can then lead to peritonitis, which is a serious inflammation of the abdominal cavity lining, and this can be fatal, okay? Now, let's look at the symptoms of appendicitis. Now, dull pain near the navel or upper abdomen that becomes sharp as it moves to the lower right of the abdomen is usually the first sign, okay? So, for the NCLEX exam, try to remember what we call McBurney's point, which is basically the name given to the point over the right side of the abdomen that is 1/3 of the distance from the anterior superior iliac spine to the umbilicus or the navel area of the body, okay? And basically this point roughly corresponds to the common location at the base of the appendix, okay? Where it kind of connects with the cecum, right? Now, also, there would be, for more symptoms, there would be a loss of appetite, there would be nausea and vomiting, definitely abdominal swelling, and there can be a fever, a high fever, and severe abdominal cramps. Okay? So, how do we diagnose our patients with appendicitis? Well, it can be sometimes tricky because the symptoms of appendicitis, like I mentioned before, are frequently very vague and very extremely similar to other problems. So, several tests are going to be usually used to help make a better diagnosis, and that includes abdominal exam to detect the inflammation, right? There would be a urine test to rule out a UTI or urinary tract infection. The physician can also do a rectal exam, and a blood test can be done to see if there's an infection in the body, okay? And also a CT scan or ultrasound will also be done. So, how do we treat our patients with appendicitis? Like I mentioned before, surgery is going to be needed to remove the appendix, and we call this appendectomy, and it's the standard treatment for almost all cases of appendicitis. Now, generally, if appendicitis is suspected, the doctor will quickly remove the appendix to avoid the rupture, right? And if the appendix has formed an abscess, you may have two procedures that can be done. One is to drain the abscess of pus and fluid outside the body, and the other one would be to remove the appendix. So those are your only two options. Now remember, with appendectomy, antibiotics are given before appendectomy to fight possible peritonitis or other infection, and general anesthesia would usually be given. And nowadays, usually the appendix is removed through laparoscopy, which is just a 4-inch incision done in the stomach. Now, after the appendectomy post-op, as the nurse, you got to make sure to watch the patient for signs of an increased pain in the abdomen, or especially blood in the vomit or in the urine, redness in the incision area, or a high fever, because any of these signs can trigger a major issue. Therefore, the physician should be prompted as soon as possible, okay? Now, this is just a quick, short review. Thank you so much for watching. I really do appreciate it, and I wish you guys the best in your exam. I know you guys will do well. Thank you, and God bless. Hey everyone, how is your NCLEX review going? Today we're going to be talking about endocarditis. Again, I do want to apologize if you do hear my infant daughter playing in the background. So today we're just going to go straight to the point with endocarditis, right? What's endocarditis? It's basically an infection of the endocardium, which, as we all know, is the inner lining of your heart chambers, right? And the heart valves. Okay, now, endocarditis can actually be bacterial or fungal infection, okay? and usually it can be fatal if left untreated. But with proper treatment, most of our clients will recover. Okay. The problem with I'm sorry, guys. The problem with endocarditis is that it can infective endocarditis can cause severe valvular damage, which can eventually lead to insufficiency and heart failure, which is really bad. So we don't want that. Okay. Now, what are the possible causes? Now, the main possible causes are staphylococci, which is Staphylococcus aureus, and also streptococci, which is Streptococcus viridian. Okay. Now, looking at the assessment, how do we assess our patients? Aside from the usual fever, chills, and fatigue, the patient can also have uncommon um, symptoms, right? Uncommon in other diseases such as rot spots, right? And rot spots is basically when you see white centers on the retina of our patient, and those white centers are actually hemorrhagic areas. Okay. Another one is osternodes, which is basically just tender raised lesions that can be found in the finger or in the toes. Okay. And lastly is valvular insufficiency with our patient's heart valves. Okay. Now, diagnostics. How do we evaluate the diagnosis for the patient? Usually, echocardiography can reveal a valvular damage, and usually the EKG can also show some arrhythmias, right? But the main diagnostic would be blood cultures. Now, there's actually 3 blood cultures taken at 1 hour intervals that is done in order to enable us to identify the actual causative organism that is causing the patient's endocarditis. Okay. Now, in regards to treatment, bed rest is important. Also, sufficient fluid intake, and also in severe cases of valvular damage, we do need surgery in order to replace the defective valve. Okay. Now, with drug therapy, we can give our patient antibiotics, which obviously would depend on the infective organism, right? We can also give antipyretic, such as aspirin, and anticoagulant. And usually, with a patient with endocarditis, the main anticoagulant that is used is heparin. Okay. Now, what I want you guys to really take note is that you need to watch for signs and symptoms of embolization. Now, embolization, as we all know, is just formation of embolus that might lodge into the bloodstream of the patient, right? So we need to watch signs and symptoms of embolization, such as hematuria, pleuritic chest pain, left and upper quadrant pain, right? Because embolization can actually be a common occurrence during the first 3 months of the treatment, okay? And these signs and symptoms can indicate an impending peripheral vascular occlusion or a pulmonary infarction, which can be bad for a patient. Okay. So again, this is it for now, guys. I just want to keep it short, sweet, and straight to the point. I hope you guys are doing great on your review. I wish you guys the best. Thank you so much for your time. I really do appreciate it. Thank you so much, guys. God bless. Thank you. Bye bye. Hey guys, how's everybody doing? First off, I really do want to apologize. I haven't posted any videos in a long while. It's because I just recently had my infant daughter, and she's been really keeping me really busy. There's actually her in the background playing, if you do hear noise and tinkering in the background. Also, I do want to mention that I just want to make these reviews short and sweet and straight to the point so that, you can really take in the main points and really focus on what is important. So today we'll be talking about synthroid or synthetic levothyroxine, which is basically a thyroid hormone therapy, right, that we give to patients with hypothyroidism, right? And as we all know, hypothyroidism is a condition in which there's an inadequate amount of circulating thyroid hormones, specifically the T3 and T4, right? T3 being tridothyronine and T4 being thyroxine, right? And basically this causes the decrease in the metabolic rate in the body, okay? Now, what we need to take note with synthroid is that we do have to monitor the patient's cardiac system because there's a significant cardiovascular disease that accompanies with a patient with hypothyroidism. And when we are giving thyroid hormone therapy, there's the client is at risk for cardiac complications if the metabolic rate is increased too quickly, right? Therefore, we do have to monitor the patient's cardiac system for cardiovascular compromise. Okay, and we can see these symptoms such as manifesting as palpitations, maybe chest pain, shortness of breath, and obviously tachycardia and a rapid heart rate. Okay, again, I'm sorry, that's my daughter in the background. Also, with this medication, treatment begins slowly, and the dosage is increased every 2 to 3 weeks until obviously the desired response is obtained. And the treatment is also considered a lifelong treatment. Okay, and obviously we're going to have an ongoing medical assessment of the thyroid function of the body. Now, also, I do want to point out that with clients receiving thyroid replacement therapy, they do need to be monitored for signs and symptoms of hyperthyroidism, right? Which can occur with over medication. Now, these symptoms that I have here is actually symptoms for hypothyroidism, which, as we all know, weakness, fatigue, and weight gain. But like I mentioned before, we do have to monitor the patient for hyperthyroidism once we're giving the thyroid hormone therapy. And the signs and symptoms for hyperthyroidism is irritability, tremors, and tachycardia, and usually palpitations. Okay, so again, guys, this medication is very important in the NCLEX exam. You do have to take note and be aware the important interventions, nursing interventions that we do have to know about for Synthroid. Okay, again, this is it for now, guys. I just want to make it short and sweet and straight to the point. I hope everybody's doing well. I will be making more videos from now on. It's just because life has just been very busy lately. Again, thank you so much, guys. I really do appreciate your time. Thank you so much for everything. God bless. Thank you. Bye bye. Hey everyone, how's your NCLEX review going? I hope everything is doing fine. Today we're gonna talk about tracheostomy, and this is just gonna be short and sweet and just straight to the point. Okay, so first let's talk about tracheotomy, right, which is the sterile surgical incision into the trachea. And usually the main purpose for this is to establish airway in our patient, and this is usually used for a long-term, usually mechanical ventilation for the patient. Okay, now we can talk about tracheostomy. Now, tracheostomy, on the other hand, is the stoma, or the opening that results from the tracheotomy. And what this does is it allows the insertion and the maintenance of the cannula, right? Now, usually a double lumen tracheostomy tube has 3 parts, okay? The 3 major parts. It's the outer cannula, the inner cannula, and the obturator. Now, the outer cannula is just the one that fits into the stoma and keeps the airway open. Okay, so that's really all it is. And the inner cannula basically helps locks the outer cannula into place. Okay, and the obturator basically helps and allows the outer cannula insertion. Now, the main thing that you have to know with the obturator is that with the obturator, it is removed immediately after the outer cannula insertion, and it's always kept with the client at the bedside, okay, in case of what we call an accidental decannulation, or if the cannula falls off. Okay, so this has to be in the patient's bedside. Now, our patient is at risk for aspiration. Okay, now swallowing is actually possible with tracheostomy, with a tracheostomy tube in place. However, there's what we call a laryngeal elevation, right? And it's affected, and therefore we do need to assess the patient's risk, right? The patient is going to be risk for aspiration. Therefore, prior to any intake, whether it's medication or food, we do have to assess the client for aspiration. Okay. Lastly, inability to produce sound. Okay, so what's going on is that the airflow in and out of tracheostomy usually would bypass the vocal cords, right? And obviously that would result in the inability to produce sound or speech. So that's basically it. The airflow in the tracheotomy bypasses the vocal cords. Okay. Now, again, guys, I just want to keep this short and straight to the point, so you really know the most important major points, such as the obturator, right? That is very important to have it at the client's bedside. Now, again, thank you so much, guys, for your time. I really do appreciate it. Thank you so much. I really wish you the best. I hope you pass your NCLEX exam. Thank you so much for your time. God bless. I'll talk to you later. Bye-bye. Hey everyone, how's everybody doing today? I hope your NCLEX review is doing okay. Today we will briefly go over thoracentesis, okay? Now, what is thoracentesis? Thoracentesis is basically a surgical perforation of the chest wall and the pleural space, okay? Now, what that basically means is just a surgical insertion, right, of a large bore needle into the chest wall of our patient, okay? Now, this is usually done to either to obtain specimen for usually diagnostic evaluation. This can be used for medication, such as instilling medication into the pleural space, okay? And it can also be done to removal of effusion or air from the pleural space. Now, when I say effusion, that basically means fluid. Okay, so it's basically the removal of fluid or air from the pleural space for usually therapeutic relief or pleural pressure. Okay. Now, usually our patient is given a local anesthetic. Okay, and usually the patient the procedure can be done at the client's bedside or usually at a procedure room by the physician. Okay, and now in regards with locating the effusion site or the insertion site, what we do is in order to locate the needle site, we're gonna percuss the patient, we're gonna auscultate. We could also do radiography and sonography, okay, to locate the effusion. Now, how do we assess our patients? Usually, there would be obviously a decrease in breath sounds, okay? There would be a decrease in chest and wall expansion, and there would be a lot of pain, and the pain is usually due to the inflammatory process, okay? Now, in regards, this thing is very important that we need to know about is fluid removal, okay? You need to know that the amount of fluid removed is limited to 1 liter at a time, and this is to prevent cardiovascular collapse to our patient. Okay. Now, this is it for now, guys. I just want to keep it short, straight to the point, and really hit on the most important basic things that you really do need to know for in regards with thoracentesis. Again, thank you so much for your time. I really do appreciate it. I wish you guys the best. Thank you. Good luck. God bless. Bye bye. Hey everyone, how's everybody doing today? I hope your NCLEX review is doing well. Today we will be going over a topic that not a lot of people really go over, and that's thyroid storm, or what we call thyrotoxic crisis. And basically, we all know it's a complication of hyperthyroidism. But what it is it's a severe complication, right? Because what occurs is that there's a surge of large amounts of thyroid hormones going straight into the bloodstream, causing a severe increase in the metabolism in the body. And this is actually considered a medical emergency because this this has a very high mortality rate. Okay. Now, another thing that you want to take note is in regards with thyroidectomy, which is basically a surgery, and this can also be a complication after a subtotal thyroidectomy, because what occurs is there's a lot of manipulation of the gland during the surgery, and this can in turn cause a thyrotoxic crisis. Okay. Now, in regards to signs and symptoms, we do need to take note that a patient could have hypothermia, could be hypertensive, and there would be a lot of abdominal pain. Okay. Now, interventions as a nurse, we do need to maintain a patent airway, and we do need to continuously monitor the patient for dysrhythmias. Okay. Now, we can also give the patient acetaminophen, but aspirin is actually contraindicated for this patient because with aspirin, what it does is it can release what they call thyroxine within the protein binding sites, and this in turn can be bad for the patient. Okay. Now, lastly, we do need to give IV fluids as prescribed by the doctor in order to hydrate the patient and also to help prevent vascular collapse. Okay, so this is it for now, guys. I just want to keep it short and straight to the point. I hope you guys are doing well in your review. I wish you the best. Thank you so much for your time. I really do appreciate it. Thank you so much. God bless. Talk to you later. Bye bye. Hey everyone, how's your NCLEX review going? Today we will be talking about Myxedema coma. Okay, so Again, I do want to apologize if you do hear noise and tinkering in the background. That's my lovely infant daughter playing. So, again, we're going to be talking about myxedema coma. As we all know, it's basically a loss of brain function, right? Usually as a result of severe hypothyroidism or an untreated hypothyroidism, right? Again, I do apologize the background noise, and it is considered a life-threatening complication. Okay, and what are the signs and symptoms in our patient? Usually, what we see is a depressed respirations, and usually these are significantly depressed respirations. Therefore, our PaCO2 or the partial pressure of carbon dioxide in the arterial blood would actually be increased to compromise the decrease of respiration, right? And obviously the normal, as we all know, the normal PaCO2 is between 35 and 45 millimeters of mercury. Okay, you need to know your values. That's very important. Also, what we would notice is a decrease in cardiac output. So it's actually not an increase, but a decrease. I don't know why I have an increase here, but it would be a decrease in cardiac output with our patient, right? And it would be a severe cerebral hypoxia, right, which is a decrease in oxygenation within the tissues. So, what are the main nursing interventions that we need to do? Basically, we need to maintain our airway. Uh, we need to have IV fluid replacement to our patient. We also do need to provide continuous EKG monitoring with our patient. Okay. Now, in regards with pharmacology, we we're going to be giving thyroid. I'm sorry again, guys, for the background noise. We will be giving thyroid hormone therapy, right? And the main NCLEX drug for hypothyroidism and myxedema coma is levothyroxine, right, or Synthroid. Now, also remember there are a few things that you do have to know while giving Synthroid. We do have to take note that the client is at risk for cardiac complications if the metabolic rate is increased too quickly, right? Therefore, we do have to monitor the cardiac system, right? So, since the patient could be cardiovascularly compromised, right? And the symptoms for that are palpitations, shortness of breath, chest pains, and also tachycardia and or rapid heart rate. Okay, so again, I'm just making this short and straight to the point, guys. I want it to be less than 5 minutes, and I will be going over other NCLEX diseases in the future. Thank you so much for your time. I really do appreciate your time. Thank you so much, and thank you for your patience. God bless. Bye bye.